Hi everyone, I'm back again. Thanks so much for watching my presentations. Before this very presentation, which is Angle Closure Glaucoma, I have published one which is Open Angle Glaucoma. So my presentation on Open Angle Glaucoma is very important for you to be able to understand Angle Closure Glaucoma in details. But if the diagnosis has been made in you, in your friends, in somebody close to you, and you want to know more facts as far as angle closure glaucoma alone is concerned, don't worry, then let's go. This presentation will take us through the probable risk factors and, of course, the ethnical or racial differences between the people that are prone to open angle glaucoma and those that are prone to angle closure glaucoma. And later on, I'll be talking about the treatment generally. So now, let's go. Like you must have come across it in open angle glaucoma. Glaucoma is a collection of ocular or eye diseases that lead to optic neuropathy and visual loss or blindness. It's expected to be a neurodegenerative condition and with intraocular pressure that is raised. But it is noteworthy to declare that it is not in all cases that we have raised intraocular pressure, and not in all cases of raised intraocular pressure that will have glaucoma. So, optic disc is seen to be cupped by the ophthalmologists who will use their sophisticated equipment to look through your eyes. The first impression when it comes to glaucoma is peripheral visual field loss, and later on there will be visual acuity deterioration, and blindness will set in later. And for everyone who feel concerned, glaucoma is one of the leading causes of blindness worldwide, and it's affecting the elderly the most. That is not to say that the children are left out. No, I will go into details of glaucoma in children after this. The increase in ocular pressure compresses and damages the optic nerve, thereby preventing transmission of images or impulses to the center in the brain, and the blindness here will be permanent in the end. The normal pressure intraocularly is 8 to 21 millimeters of mercury. When we pick the value that is 23 to 24, we'll repeat the measurement. And when we pick the value that is 25 to 29, we'll follow up in 1 week if there are no any other serious signs and symptoms. But when we pick the value that is between 30 and 40 millimeters of mercury, we'll get our paper for referral to ophthalmologists immediately. But if the value is greater than 40 millimeters of mercury, that is an emergency situation, and intervention must begin immediately. Glaucoma is the second leading cause of blindness worldwide. The leading cause of blindness in blacks, particularly open angle glaucoma. The open angle glaucoma is found in blacks and some Europeans, but take note of this: angle closure glaucoma that I'm talking about right now is common in Asians and some whites. The first symptom, like I've said just a few minutes ago, is peripheral visual loss, and that will affect driving, leading to possible road traffic accidents, falls, and so on. The differential diagnoses are all possible causes of red eye, and I will not go into details of that because I have a separate presentation on causes of red eye. So you can check my channel for that. Causes of red eye. Total vacant MEMS. Check my channel for that, please. The risk factors for primary angle closure glaucoma will be Family history of angle closure glaucoma. No, I am being specific here, not open angle glaucoma, angle closure glaucoma. Also, the age greater than 60, common in females. And note this, hyperopia, that is far-sightedness. Remember when I was going over the risk factors for open angle glaucoma, I said myopia, that is short-sightedness, okay? And I even made jest of myself that I also have short-sightedness, so that I'm myopic, right? Okay, so hyperopia is the issue. Far-sightedness, okay, will lead to primary angle closure glaucoma. Citing medications, I'll go over them later on. Pseudoexfoliation forming flaky deposits, and that will be weakening the lens, and it's commoner among Asians. What are the medications that could be responsible for angle closure glaucoma? Ceftra, combination of trimethoprim and sulfamethoxazole. Amphetamines, to those that have ADHD and are taking amphetamines, watch out. Or to those who are abusing drugs and they are taking amphetamines, watch out. You can have acute closure glaucoma. Tricyclic antidepressant, selective serotonin reuptake inhibitors, or serotonin norepinephrine reuptake inhibitors, that is venlafaxine and the likes, could all cause acute closure glaucoma. Cholinergics, like pilocarpine or carbachol. Diuretics, hydrochlorothiazide, acetazolamide, that is carbonic anhydrase inhibitors. We actually use these to treat open angle glaucoma, not acute closure glaucoma. With our two agonists like salbutamol or terbutaline for those with asthma or COPD. Watch out. Antihistamines, anticonvulsants like Topiramate, anticholinergics, adrenergic agonists like epinephrine, ephedrine, dipivirine, and so on, who all cause acute closure glaucoma. What are the signs and symptoms? The signs are what could be picked by the healthcare provider. The symptoms are what the affected individual will complain about. So the signs are conjunctival redness. That's why glaucoma is one of the differential diagnoses of red eye. Then when the cornea is inspected, it's likely going to be cloudy and edematous, swollen cornea and cloudy. When the pupil is checked, it is going to be dilated and the anterior chamber will become shallow. What are the possible symptoms? The affected individual will complain of decreased vision, halos around light, headache, eye pain, and of course nausea and vomiting. Okay, let's go into a little bit of in-depth medicine. And to even my friends that are studying some other courses outside medical field, don't be scared, it's not into big deal. So you can grab it, you are pretty smart. Ciliary body will produce the aqueous humor. The aqueous humor produced will flow through the pupil. So when it gets to the anterior chamber, it's supposed to exit the eye. The production should be equal to the drainage. Then everything is normal, right? However, if lens is resting against the iris anteriorly, the pupil will be blocked, okay? And remember, I said ciliary body will produce the aqueous humor and should flow through the pupil. Now, when the pupil is blocked, there will be increased pressure. Also, Scarring can also occur with trabecular meshwork damage, and this occurrence can be done or happen suddenly. Most of the time, acute closure glaucoma issue will occur suddenly. Attacks and resolution can occur in rapid successions. So there'll be attack, there'll be relief, attack, and relief. But quick blindness is possible here. That is, in acute angle closure glaucoma, one can become blind within short period of time. Unlike open angle glaucoma, the blindness could take several months to years. Here, with acute angle closure glaucoma, blindness could be very quick. Giving us what impression? That is, we need to act fast and act now. Note, the width of the anterior chamber can dictate if it is narrow. Then there is going to be increased possibilities of acute closure glaucoma. In chronic angle closure glaucoma, there won't be a complete blockage, may not even have any symptom, but optic nerve could have been damaged by the time the diagnosis is made. The secondary angle closure will have two features. It's either pushing or pulling. Pushing is when iris or ciliary body is pushed forward. Okay? While pulling is when there's deformed iris and it's retracted into the angle. So pulling the iris into the angle. Okay? So what are those situations that could cause pushing? That is, when iris or ciliary body could be pushed forward. Okay? Pupillary fibrosis will lower the gap between the pupil and the iris. Okay? Choroidal hemorrhage or medication like anticonvulsant called Topiramate will cause acute angle closure glaucoma. Plateau in iris syndrome, or when the lens is very large or displaced. What about past surgery diverting the flow and choroidal effusion or even cancer called retinoblastoma? By the time we get to possible causes of glaucoma in children, we'll go more into that. How about pulling? Okay, fibrosis after inflammation in the angle itself could lead to pulling or abnormal corneal endothelial cell proliferation. Past trauma or surgery and invasion of the angle by fibroblast could lead to pulling. Okay, and with that, I'm going to end the presentation on angle closure glaucoma. Remember, there's a separate presentation on open angle glaucoma. So the next presentation now will be glaucoma in newborn and older children, after which I will make a final presentation on treatment of all these different types of glaucoma in general. And with that, I will say thank you for listening to my presentation. Kindly subscribe to my channel. You can leave comments on my channel at comment section or anything you like to say about these presentations. I appreciate your time.